Hello friends, this is Dr.Singhal from Chandigarh. My friends, I am a practicing homeopathic physician for last say about 14 years. I am into this profession, and my friends, today we are going to discuss a very serious, very short disease. Theoretically, it is very short disease, but practically, this is a very chronic problem. This is a very common problem, and just because of poor lifestyle, I'll make it very clear to you, just because of poor lifestyle and some hereditary factors, this disease has given rise to number of patients who are not able to move itself. My friends, I am talking about gout. I am talking about uric acid. How this uric acid deposits that happens inside the joints, how it develops. So coming to the first of all the definition of gout, this is a increased uric acid crystals deposition inside the joint cavities. So my friend, this uric acid, just because of this, arthritis may develop, and this type of arthritis is called as gout. This arthritis is of maybe of two types, monoarticular as well as polyarticular. Certain joints, single joint may be involved, either of foot or of your hand or of your single articular joint may be involved, but sometimes this may be involving some combined joints. So 2, 3 or more joints may be affected at a time. So coming to the hyperuricemia, for example, if uric acid content, the uric acid basically, coming to uric acid first, uric acid is a byproduct of purine metabolism, which happens during digestion and absorption assimilation process during the digestive system process. So my friends, whenever there is a rise of uric acid inside the blood, this condition is called as hyperuricemia. Normally, it is being excreted by our kidneys and other excretory organs, but in certain cases, just because of crash diet, as I have told you, excess intake of meat, chicken, mutton, beef, and lack of physical activities, poor lifestyle, this may give rise to hyperuricemia. And whenever hyperuricemia develops, after certain period of time, arthritis may develop. Coming to this involves mono and polyarticular. And my friends, coming to the symptoms of gout, how we should be able to differentiate between osteoarthritis and the gout patient. First of all, in gout, we'll have all the symptoms of inflammation present, like rubor, redness, calor, heat, dolor, pain, tumor, swelling, functional loss of function. So these are 5 types of symptoms present in all types of inflammations. But here, my friends, I would like to indicate here that redness is very marked above the joint. जब आप joint को touch करते हैं, this is very tender to touch. It means dolor part, painful swellings. This calor may be present. This calor, heat and warmth inside the joint. Patient feels that डॉक्टर साहब जॉइंट के विचों ना जिथे स्वेलिंग हैगी है सेक निकलता है. डॉक्टर साहब जहाँ मेरे को जॉइंट के ऊपर ये स्वेलिंग है उसमें से मेरे को सेक भी निकलता है. Confirmatory symptom for gout. So my friends, whenever this hyperuricemia, especially uric acid crystals deposits one after the other, this may give rise to tophies. Tophies means the deposits, extra deposits of uric acid crystals inside a single or multiple joints. So coming to the different types of stages, first stage is asymptomatic. Sometimes patient may feel that he is having high uric acid. My uric acid is above 8 or 9, but I am having no symptoms. So patient come to us and they seek medical opinion. Most of the time patient says that, doctor, I am having very high uric acid, but I am having no symptoms. So my friends, this stage is very critical. Don't just ignore these type of symptoms, because if your uric acid is going above the normal values, then one or the other, after 1 or the 2 years, you may suffer from some acute phase of this problem. So first stage is always asymptomatic. This may be up till 2 years, 3 years, maybe up till 5 years. Patient may or may not develop any type of symptoms. But in certain cases, sometimes during an acute attack of uric acid, patient comes with a severe swelling of a particular joint and functional ऐसा, he'll not be able to move the joint. So crippling and this loss of movement, this is a very strong feature of this disease. Patient will be totally bedridden. And whenever we have to look for these type of patients, we have to confirm again and again, don't go for steroids, don't go for painkillers, don't go for antibiotics. Sometimes these painkillers as well as antibiotics may aggravate the condition of the uric acid inside the joint. So my friend, coming to the third stage, that is intercritical stage. This is again asymptomatic, but this stage may persist with or without pain. And the fourth one, so first stage is asymptomatic, second is acute attack, third is intercritical, and fourth is chronic. So this fourth stage, this is the chronic stage. This is the most frequent attacks patient gets. Very frequent acute attacks of gout, acute attack of uric acid crystal deposition, and with the very painful swellings inside the joints. This condition is very common. So patient mostly comes to a homeopathic doctor in fourth stage of gout. Here I would like to specify that totalistic approach as we prescribe in homeopathy on the basis of totality of symptoms. So this medicine, homeopathic medicines, is strongly recommended. This medicine is strongly recommended because in conventional mode of treatment we don't have any type of treatment except giving some purine metabolic deactivators like Zylyric or some other tablets just to reduce uric acid, but not to cure the internal derangement of the system. So with homeopathy, what do? Basically, we cure the patient right from the internal. We try to bring the internal harmony of the system, and whenever patient get harmony inside the system, he or she may not develop the pain and the sufferings of the feeling just like experienced in gout. So my friends, this was all about gout. I have covered causes, I have covered symptoms, I have covered 4 stages coming to the treatment, and I have discussed especially the poor lifestyle. So my friends, in case of any patient suffering from gout, you can contact to our clinic directly as the numbers being flashed in the video, or you can mail to us. For a special chat, you can give a mail to us and you can contact with us. I hope this video will help you out. Thank you.